Hey everyone, welcome back. We're going to be taking a deep dive into something today that could seriously shake up the world of smoking.
Oh, yeah.
The FDA has come out with a proposed rule to put a limit on how much nicotine can be in cigarettes.
It's pretty wild.
Yeah. So we've got a bunch of articles here uh, covering like all different sides of this thing.
Right.
From what the FDA is actually proposing and how big tobacco is reacting
Uh-huh.
to, what farmers down in North Carolina are saying.
Where it's a big deal.
Yeah, where tobacco is like their bread and butter.
Exactly.
We'll be looking at some analysis from policy experts, too,
Trying to figure out.
so we can really get the whole picture.
Yeah, what the ripple effects might be.
Because this thing could have huge consequences.
Absolutely.
So the FDA's goal here is to basically make cigarettes less addictive
Right.
by putting this cap on nicotine levels. And they're talking about like a really low amount, just 0.7 milligrams per gram.
Yeah, and they're projecting some pretty big changes from that. Like 13 million smokers quitting within a year of this going into effect.
Wow.
And something like 48 million young people who might never start smoking because of this rule.
Gosh, that's huge.
By the year 2100, that is.
Yeah. Wow.
Think about that. That's like almost the whole population of California just choosing not to smoke.
That really puts it into perspective.
Yeah.
So this is all assuming this rule actually goes into effect, though, right?
Right. Well, it's not going to happen overnight.
Yeah.
The FDA is proposing a 2-year period for companies to actually make the changes after it's finalized.
Okay, so 2 years to get their act together.
Exactly. And even then, there's no guarantee it'll actually get finalized.
Right. Of course, there's a lot of politics and legal stuff to work out.
Absolutely. We'll get into that a bit later.
For sure. So we've been talking about cigarettes, but does this rule apply to, like, all tobacco products?
That's a good question. It would cover cigarettes, obviously, and cigars and pipe tobacco, but it wouldn't apply to e-cigarettes
Okay.
or other alternatives that are maybe considered less harmful.
Interesting. So it's really targeted at those traditional tobacco products.
Yeah, that's a key detail to keep in mind as we go through all this.
For sure. Now, one company that's been all over the news lately because of this is 22nd Century Group.
Oh, yeah, they're interesting.
They've already developed these reduced nicotine cigarettes. They call them VLN cigarettes.
Mm-hmm.
And they actually already meet the FDA's proposed standard.
It's kind of remarkable.
Yeah, like they're way ahead of the curve.
Big time. Their cigarettes have like 95% less nicotine than a regular cigarette.
Wow.
And they're already selling them in over 5,000 stores around the country.
Really?
Yeah. And it's important to note that these are FDA authorized.
What does that mean exactly?
So that means they've gone through all the testing and met all the safety and effectiveness standards that the FDA sets.
Oh, so it's not just some random company making claims?
No, they've done things by the book.
Okay, so they're kind of like in the perfect position then,
No.
if this rule goes through.
Right, like they have a huge first mover advantage.
Yeah, no kidding. Imagine if all the big tobacco companies have to come to them to license their technology or something.
Or scramble to catch up and develop their own solutions.
It's like they've struck gold.
Potentially.
I read that they're currently valued at about $4.5 million.
Uh-huh.
Could that number, like, explode if this regulation passes?
It could definitely go up, but, big tobacco is a powerful force.
For sure.
They've got deep pockets, and they could easily invest in their own low-nicotine products, or even try to fight the regulation altogether.
Right, so it's not a guaranteed win for 22nd Century Group.
Definitely not. It's going to be interesting to see how it all plays out.
Yeah, it's like David versus Goliath.
Exactly, and then there's the whole economic impact to consider.
Right.
Especially for places like North Carolina, where tobacco farming is a big part of the economy.
Right, we can't forget about them.
They're definitely worried about what this could mean for jobs and their livelihoods.
Yeah, I've seen some statements from North Carolina lawmakers, and they're not happy about this.
I can imagine.
Especially those who represent districts with a lot of tobacco farmers.
Makes sense they're worried about their constituents.
They're saying this could be devastating for rural communities.
There's a study from the John Locke Foundation.
Who are they?
They're a conservative think tank based in North Carolina.
Okay.
And they estimated that this rule could cost North Carolina something like 169,000 jobs.
Gosh.
And $48 billion in economic activity.
That's a huge chunk of change.
Yeah, they're arguing that the Biden administration's proposal could really cripple those rural areas that depend on tobacco.
So on one hand, you have the potential to make cigarettes less addictive and help people quit smoking.
Right.
But on the other hand, you have the potential to put a lot of people out of work.
It's a tough situation.
Yeah, it's like a trade-off. No easy answers here.
No, it's a complex issue with a lot of different angles to consider.
So how do they come up with those numbers anyway?
Well, they used economic modeling to try and simulate what would happen if the rule went into effect. They looked at things like the decrease in demand for regular cigarettes, the potential for people to switch to other products, and the impact on related industries like transportation and manufacturing.
So they tried to account for the ripple effects throughout the economy.
Exactly. It's not just about the tobacco farms themselves, it's about the whole ecosystem.
Right, so it's a much bigger picture than it might seem at first glance.
Definitely. And it highlights the tension between trying to improve public health and protecting economic interests.
Yeah, you can't just focus on one without considering the other.
Exactly. This FDA proposal really brings that tension to the forefront.
It's forcing us to ask some tough questions about how we prioritize different values.
Right.
So we've got the potential benefits for public health, the economic concerns for tobacco-producing states, and then this company, 22nd Century Group, who's kind of in a prime position to capitalize on all this.
It's a fascinating situation.
It really is. Where do we go from here?
Well, next we should probably take a closer look at the potential political and legal battles that are brewing around this proposal. Wow.
Okay, yeah, because there's a lot of uncertainty about how this is all going to play out.
Absolutely.
All right, so we talk about how this could affect public health and the economy, but what about the politics of it all?
Right.
You know, this rule was proposed under Biden, but now we've got a whole new administration in there.
Yeah, things could change.
With different priorities, maybe.
Absolutely. There's definitely a lot of uncertainty about what'll happen to this proposal now that Trump is in office.
Yeah.
And we haven't really heard anything from Robert F. Kennedy Jr. about it.
Trump's nominee for health secretary.
Right. He hasn't publicly said where he stands on tobacco regulation.
So he could go either way.
Exactly. He could push for this rule or he could totally ignore it and focus on something else.
So even if this rule does make it through all the red tape,
Yeah.
there's no guarantee that it'll actually get implemented smoothly.
Not necessarily. You know, tobacco companies are probably going to fight this thing tooth and nail.
Yeah, I bet they're not happy about it.
Yeah. Nope. They've got a history of challenging any regulation that threatens their profits.
You know, it's like those light and low tar cigarettes they used to market.
Oh, yeah.
And they ended up being just as bad for you
If not worse.
because people just smoked more to compensate for the lower nicotine.
Exactly. It's like a loophole.
Yeah. And they got banned eventually for being misleading.
Right. So that's a big question with this new proposal, too.
Like, are people actually going to smoke less
Or will they just smoke more of these reduced nicotine cigarettes?
to get the same buzz?
Exactly. We don't really know yet.
So has the FDA done any research on how effective these new cigarettes might be at helping people quit?
Well, they have some studies that suggest smokers using very low nicotine cigarettes tend to smoke less, and they're more likely to try quitting.
Okay, so that's promising.
It is, but it's still early days. You know, we need more long-term data to really understand the impact.
So it sounds like this whole thing is still very up in the air.
It is. There are a lot of moving parts.
Yeah, we've got this potential game changer for public health.
Uh-huh.
But it's facing all these political and legal hurdles.
Right. And it's going to be really fascinating to see how it all unfolds.
Sure.
You know, it really brings up some important questions that we should be thinking about.
Like what?
Like, how do we balance the potential health benefits of reducing smoking with the economic concerns of people who depend on the tobacco industry for their livelihoods?
That's a tough one.
It is. It's like two sides of the same coin.
On one hand, you've got the potential to save millions of lives and cut down on all those smoking-related illnesses.
Right.
But on the other hand, you could be disrupting a whole industry.
And putting people out of work.
Yeah, it's a real dilemma.
It is. And it shows how even well-intentioned policies can have unintended consequences.
Right. You got to think about the big picture.
Absolutely.
So how do we move forward then?
Well, I think it starts with having honest conversations about this issue.
Okay.
You know, acknowledging both the benefits and the risks and really weighing them carefully.
Yeah.
And we need to be thinking about everyone involved, not just the smokers, but also the non-smokers, the farmers, the communities that rely on the tobacco industry.
That's a lot of people.
It is, and everyone's perspective matters.
What are some things you think our listeners should be considering as they learn more about this?
One thing to think about is personal responsibility.
Okay.
You know, should people have the freedom to smoke, even if it's harmful?
Right.
Or should the government step in to protect people from their own choices?
That's a really interesting question.
It is. It's a debate that goes way beyond just smoking.
Yeah, where do you draw the line between individual freedom and public health?
Exactly. And then there's the question of how we balance the potential benefits of regulation with the potential costs.
Right.
Is it worth disrupting an industry and maybe causing job losses if it means saving lives?
That's a tough call.
It is. There's no easy answer.
And we need to think about the long-term effects, too.
Absolutely.
If this rule does reduce smoking rates,
Yeah.
it could save a ton of money on healthcare costs.
Oh, right. And improve overall health.
But we can't just assume that lowering nicotine is going to solve everything.
No, it's not a magic bullet.
People who are addicted to nicotine might just turn to other sources.
Yeah, like e-cigarettes or even black market cigarettes.
If they can't get their fix from regular cigarettes.
Exactly. So it's not just about reducing supply.
We need to address the demand, too.
Absolutely. We need to make sure people have access to programs that help them quit smoking.
And resources.
And we need to keep researching and developing safer alternatives.
So there's a lot of work to be done on multiple fronts.
Definitely, it's a multi-pronged approach.
But it's an important conversation to have.
It is. The more informed we are, the better decisions we can make.
For ourselves and for public health.
Exactly.
Well, I think we've covered a lot of ground today.
We have.
But before we wrap up, I want to touch on one more thing.
Okay.
The history of low-nicotine cigarettes.
Oh, yeah. That's an important piece of the puzzle.
Because we talked about those light and low-tar cigarettes. But those weren't the first attempt at this.
No, not by a long shot.
Really, tell me more.
Well, back in the 80s and 90s, some companies tried to introduce low-nicotine cigarettes.
Interesting.
But they didn't really catch on.
Why not?
Well, for one thing, the technology wasn't as good back then. So the cigarettes didn't taste very good.
Oh, I see.
And also, people weren't as aware of the dangers of nicotine back then.
So there wasn't as much demand.
Exactly. It wasn't really on people's radar.
So it sounds like the context is pretty different this time around.
It is. We know a lot more about nicotine addiction now.
Yeah.
And there's a lot more awareness of the health risks of smoking.
Plus, we've got companies like 22nd Century Group that are making better tasting low nicotine cigarettes.
Exactly. So maybe this time it'll be different.
Maybe this time it'll stick.
It's possible, but only time will tell.
Right. There's still so many unknowns.
Absolutely.
Well, I think this is a good place to pause for now. We've covered a lot of ground, and I know our listeners are eager to hear your final thoughts.
Yeah.
So we've talked about the science, the economics, the politics, and even a little bit of history. What's the one thing you really want our listener to walk away thinking about?
If this FDA proposal actually works,
Yeah.
it could totally change how people think about and use cigarettes.
In what way?
We're not talking about banning them completely, but like changing what a cigarette even is.
Right.
Like, could this be the beginning of the end for cigarettes as we know them?
That's a pretty crazy thought.
It is, isn't it?
Imagine cigarettes that aren't addictive anymore.
Would people still smoke them as much?
Yeah. Would we see way fewer people getting sick from smoking?
It's hard to say for sure.
Of course.
Human behavior is complicated and addiction is powerful.
Right.
But I think it's safe to say that this rule could have a massive impact on public health.
Especially for young people who haven't started smoking yet.
Exactly. It could change the whole landscape.
It's exciting to think about the possibilities, but it's also kind of scary, right?
Yeah.
There are so many things we don't know yet.
So many potential ripple effects.
It's a good reminder that even when we try to do good things, there can be unintended consequences.
Absolutely. And that's why we need to be really thoughtful about this.
And consider all sides of the issue.
Exactly like we were talking about earlier, there are real concerns about the economic impact on places that depend on tobacco.
Right. And what if this just leads to a bigger black market for cigarettes?
That's a possibility too.
If people can't get their nicotine fix legally, they'll find other ways.
Exactly. So we can't just focus on reducing nicotine.
We need to do more.
Yeah, we need education programs to help people quit.
And better alternatives to cigarettes.
It's a multifaceted problem.
Definitely a lot of work to be done.
It is, but it's a conversation worth having.
For sure. The more we understand about this, the better decisions we can make.
Absolutely, for ourselves and for everyone else.
Well, I think you've given our listeners a lot to think about today.
I hope so.
Before we wrap up, is there anything else you want to add?
Just this, keep an eye on how this whole thing plays out.
Yeah.
It's a real-life example of how messy public health policy can be.
It is.
Watch how the FDA, the tobacco companies, the lawmakers, everyone reacts and adapts.
Right.
It's a fascinating look at how the world really works.
I couldn't agree more. I'll definitely be following this story.
Me too.
Well, thanks for joining us for this deep dive.
It's been a pleasure.
And to our listeners, thanks for tuning in. We encourage you to keep learning and keep questioning and keep forming your own opinions. Until next time, keep diving deep.